Yeah, I always say I learnt nothing at medical school about air quality. Wasn't even mentioned. I mean, we learned to talk to patients about smoking, about alcohol, and even social prescribing now as well, and thinking about home circumstances, etc., and exercise. And we have sort of screening tools at our fingertips as well for asking about those lifestyle behaviours. We don't have that for air quality, and I think that means that healthcare professionals don't have the tools at their fingertips. We've already said it's a complex area, but I think the main fundamental problem is that it's been an environmental issue for so long rather than a health issue. So it's only really recently moved into the health domain. I mean, at a national regulatory level, it sits within DEFRA, Department of Food, Environment and Rural Affairs. It's regulated through the environmental regulation landscape rather than from a public health perspective. So most of our actions to tackle air quality are on to achieve environmental objectives rather than to improve population health. So I think that's the fundamental way in which air quality has been carved out, really, and it's been very much in the environmental community rather than in the health community. I mean, if we look at other really major risks, if we look at smoking, for example, landmark legislation around smoking in public spaces was really a result of advocacy and action from both the third sector and the health professional community, and we really saw that happen there. Whether that will happen now with air quality, I think is really interesting, but I think we really need to have the confidence, we need to have the training about air pollution, so it's not hidden behind lots of numbers and different acronyms, which is another problem, I think, to understand it and to ensure that our health professionals are confident in talking about it as an issue with patients, just as we would for other risks to health.